Hello, my name is Justin, and for this homework assignment, I have scenario A, which is a patient with a 29-year-old. The patient is a 29-year-old pregnant woman, and she wants to get an MRI of her brain, but has an onset of seizures and concern for cerebral abscess. Her EFGR is 88 millimeters per minute per 1.73 meters squared, and she has no prior use of contrast. Would I proceed with contrast? I would probably not, considering that the contrast has gadolinium-based contrast agents, which is not good. It doesn't have any good effects for a developing fetus. And since she also has seizures as well, it will also have neurological deficits for the contrast. And also, since she's pregnant, she also gadolinium could cross the placenta and can have a really more like a bad effect on the fetus. And I know, which is also why before we even give her contrast, we have to screen her. So I would have to screen the patient. Basically just ask if she has any kidney disease, if she has contrast before, if she's allergic to any medications or the contrast itself. And obviously, since she's pregnant, I wouldn't really give her contrast. And then the risk of proceeding with the contrast is it could be fatal for the baby. I wouldn't even want to proceed with it right before we even put her in the room. And the risk of not proceeding, well, the baby will be fine, the mother will be fine. So I think I would rather not. I'd rather have her not give her contrast. And also, since her kidney function is at 88, which is around the normal range of a good kidney function, I would just leave it as is. Because I wouldn't want the baby to get to have a higher risk of having gadolinium in its system. And if we were to proceed with gadolinium, I would probably I would probably decide with the radiologist or the neurologist itself and weigh the risk and benefits of the contrast. Maybe we could probably give her like a small, very small dosage. But then again, she is, I think, she is 18 weeks pregnant. So we also have to keep in mind of the baby as well. But I wouldn't proceed with the contrast. Yes, she does have seizures, but there are other ways that could get a good images of her brain, like maybe like a CT scan. But the decision should be made by the radiologist. So.